a little past 10, so let's go ahead and get going today. We have, I think, 3 people online. One will be joining as well, another. So today in 1895, Bert Lahr was born. You all know who Bert Lahr is? Cowardly Lion, yes. And in 1899, Alfred Hitchcock was born. So do you see a theme here? Fear, courage. So as we do introductions today, I would like to hear from you best scary movie of all time. If you're not a fan of scary movies, how about your favorite musical, like The Wizard of Oz? Or perhaps you want to share an irrational fear you have. So let's start with Mark on this side today.
So yeah, I always end up starting before I have time to think, and then somebody thinks of a better one. I mean, if we're going to go with musicals and horror movies, the only one I know is Anna and the Apocalypse, but that's a little bit obscure there. So, best scary movie for me, I think the first scary movie I saw, we'll go with that, would be Spielberg's Poltergeist, the old original one.
I mean, I would say if we're doing combination musical and horror, I would probably go Rocky Horror. Just saying. But I think the scariest movie of all time is The Shining, and frankly, I'm not embarrassed to say I think of it every time I go to the
I do too.
Ellen?
I'm going to say the first scary movie I saw, and it sticks out in my mind, I was really young, and it was a black and white Frankenstein, and it scared me to death. And so I don't watch horror movies too much.
All right. Tracy?
I don't like scary movies either, although The Shining really good, made an impression. So I'll go with Irrational Fear, but is it irrational? I do not like parking garages. I have a hard time. If I get to work late and can't park in the flat lot, I have a hard time that I have to go into a parking garage. I have to park on the top because otherwise I'm going to get crushed by the parking garage.
Mm-hmm.
Is it a rational fear, though? I don't know if it's irrational. I deal with it.
Stephen Buckle, I don't know that. I don't really like horror movies or scary movies all that much. I'll probably go with the irrational fear. I don't know if it's a fear or a dislike or a discomfort. I don't really like when like birds get too close. I don't know what it is. We've had some ground birds that have attacked us and some other birds that just.
Then you need to
when they get a little squirrely, yeah.
Right, Liz?
I also don't really like scary movies. I was gonna say The Birds is about as scary as I can get, so I'll stick with that.
All right.
I'm going with irrational fear of grates on the sidewalk. I have to walk around them.
Mm-hmm.
I'm afraid someone's gonna grab me or I'm gonna fall through, one of the two.
Mm-hmm.
I don't really like scary movies either, so I'll go with musical. Grease. First saw it when I was 5 years old, and it's been my favorite ever since.
I don't like scary movies either, but I'm going to say Poltergeist, Birds, and It.
Yeah.
That's legitimate. Matt Alsma, nice to see you all. I dislike horror movies. My kids love them. I don't understand it. When I was a child, I saw Jaws, and I avoided Lake Michigan for years, even though it's a freshwater lake with no sharks.
No.
Yeah.
Catherine Pulley, Indiana Office of Court Services. The best horror movie is one that I don't see. And I do not like, I don't even like saying the word. So maybe it is irrational, but I do not like snakes. Yeah.
Oh, scariest movie I suppose is that I've seen is Henry, Portrait of a Serial Killer. If you haven't seen that one, it's older. Michael Rooker plays, I think it's a true story. It's sort of low budget, so it makes it a bit, I suppose, grittier. This doesn't come highly recommended. Like if you, it's really good. That's all I'm saying. I liked it.
And online today, we have Judge Dolahanty.
Good morning. Sorry,
Morning.
I'm not there in person. Darren Dolahanty, senior judge, your favorite senior judge, probably at this point. Horror movie wise, I saw a movie called Children of the Corn, I think when I was in my early teens, that just scared the bejesus out of me and still does.
Share again the movie. You cut out there for just a moment.
Sorry, it's called Children of the Corn.
Yeah. Judge Graham.
Good morning, everybody. Sorry that I was diverted by car trouble this morning. By far, scariest movie ever is The Skeleton Key.
Oh, I don't know this one. Right.
Oh, be careful, beware.
Shannon.
I apologize for not being there. I had court this morning. I don't do scary movies, and I will burn a house down over a snake. So, Catherine, I am with you on that. I do not like snakes.
Okay. We're having some technical difficulties this morning, so they've gone for assistance. Mhm. And Judge King, we're sharing to honor Alfred Hitchcock and Burt Lahr. Scariest movie of all time, or favorite musical of all time, or an irrational fear? Okay.
Bodies going against the ceiling, blood splattering everywhere. I was like, this is, I don't know.
So for me, scariest movie was The Strangers, the original Strangers, not the remake, and irrational fear, centipedes. My court reporter once said she watched a centipede walk over my shoe during court. She was waiting for the worst to happen during court. Didn't happen. So, and a fun fact about Burt Lahr for Catherine, he served in the U.S. Navy in World War I. Mm-hmm. All right. On that note, we'll go right into approval of the minutes. So you have draft minutes from the June 11th meeting. Do we have any edits for those? Yeah. If not, do we have a motion to approve? Thank you, Nancy. Do we have a second?
Second.
Thank you, Judge King. Any discussion? All in favor of approval, say aye.
Aye.
Aye. Opposed, nay. All right, minutes are approved. And welcome, Kia. We shared this morning to honor Alfred Hitchcock and Burt Lahr. Favorite scary movie, perhaps favorite musical, or irrational fear?
Absolutely irrational fear. Anything that has to do with boats, bridges, or trees.
Okay.
And it's all together, I'm freaking out.
On the street, just like trees.
And I'm such a nature girly. So I garden, I have chickens, but something about like these massive overarching trees freak me out. I don't know. I said it was irrational.
Yeah, yes. Uh-huh. All right. Moving into work group updates. We have Magistrate Foley taking grants today.
So I think all of our updates were actually contained within our work group report. We've had one, if not two meetings since the last YJOC meeting. I've been pretty busy. Our work group report does contain the amounts that have been awarded. So obviously not where we were hoping to be, but still fairly substantial all in all. One of the things that we have been talking about as a work group was trying to maximize those dollars for the counties that are really wanting to apply. So we have, I think, come to a consensus, would that be a fair statement, that we're looking to reset the cap limits. So some counties were previously capped depending on the grant and what their population size is. So we're setting everybody back to zero so people will be able to reapply for the funds that have also approved in a previous grant cycle. I'm asked Ellen and Nancy to kind of help me out since I didn't know I was doing this report until yesterday afternoon. Was there anything else either of you wanted to add to that?
Just that only applies to the diversion and community-based alternatives to detention grants. Those are the ones that are formulas. The behavioral health grants are still competitive. So that counties can apply for applies to those two categories.
So if somebody previously got a grant for, let's say, $80,000, it's reset again, so they can take, okay. Dang, we should have done that. I thought it was one-time things, but it sounds to me like it's.
And your report indicates a review cycle, so application would open again November 30th of this year.
Yes, and we are requesting review and approval of that cycle that is contained within the report. So November 30th of 2026, the application with the review committee beginning their review in beginning of March. The ICJI board awarding funding near the end of June, and then the award period beginning July 1st.
Mm-hmm. Any objections to that review cycle?
I just have a question.
Yes,
How are we
Tracy.
letting counties know that we're getting reset to zero?
That's a good question. I know we have regular updates in the Wednesday newsletters that go out to all the courts. So that would be one avenue, but I would encourage all of you to share with everyone you know. We also have the annual judicial conference coming up in September. So that would be another great opportunity to get it out to all the courts. That's the mandatory conference for all judges.
Everyone. Information. The other thing that you might see up further in the report is that we're working on a dashboard, a public-facing dashboard that is goes into a little bit more detail than the one that was previously on ICJI's website. And so counties can see it then there that they would be eligible for the funding.
Great.
And that is still in development phase, but we're making great progress.
Great. There's a
question. If folks were awarded funding in October of 2025, it doesn't expire until October of 2027. How does that overlap work? If they wanted to reapply like a second round of funding, would it? Because it wouldn't.
So they could include that information in their application that, you know, our current grant ends such and such date. You know, these funds will start after that. If there's something that is not funded in the first one that they decided would be a help in their program, that started July 1.
We have been talking a bit about some of the growing pains that we've had going from multi-applications in a 12-month period to moving to an annual application process. So we have been talking about for those folks whose funds are expended prior to this next grant cycle, if there's a way to extend their funding. So I think this is still kind of a work in progress, but we're listening to our grantees and the issues that they're having. We are putting together technical assistance programming to help, and we're actually putting together a survey as well to try and get some more feedback on where people are finding hardship in doing the application process.
Mm-hmm. Any questions regarding grants? Will the one-pager be ready for the Youth Justice Conference as well? Perfect. All right, we'll move on to the behavioral health. Do we have Sarah yet? Okay, we'll skip that one for now and come back to it. Then we'll go on to data. Dr. Alsma?
You should have all received the kind of phase 2 data report within your email handouts. Everyone get those? Fantastic. So you want to spend a little time talking about the 2 phases, and I'm going to focus on recommendations today. Those are all in the report. You can review them. They get into some detail. I am glad to get into detail. I also think it's important to kind of recognize that this was based on interviews and surveys with over 20 counties. Then we did the deep dive within 6 counties that had a mix of information systems and sizes. I want to thank our team. Their names are up there. I want to also thank Lisa Thompson, Dave Stewart, Bill Gottlieb, so purveyors of these systems that have done great work over the years. Thanks strategists for JDI that informed all this work, Nick Ackerman. And then, of course, the counties. I also want to lift up our YJOC data work group. We met with them monthly, bi-monthly, and went through this on a regular basis. So they really helped guide all of this work. I forgot, I don't point here, I point here. So developing a common data model. So we have a benefit in Indiana of the Regan Street Institute. If you drive down 10th Street on the way to VA in Eskenazi, there's a big block building called Regan Street Institute. It is the oldest agency, nonprofit, devoted to electronic health records. It's been there since the 1970s. Who knew that this was an issue in the 1970s, right? So it's clearly an issue now. And one of the first things that when anyone does hospital, primary care, electronic health record work is develop a common data model so that we really understand what's happening at a local level. So what we did on this first go around is really focus on what are the common data elements. We really focused on diversion front end because more and more youth are being diverted. It's kind of the Wild West out there right now with what counties are doing and trying to understand. And there's been some new policy in that area. So common data model, what it is, standardized logical framework to define and organize data consistently across systems and applications. And we need this to really answer questions, fulfill purpose, understand what's happening. In Indiana, we have the IHI, Indiana Health Information Exchange. So what that is, it's a nonprofit that gathers data from all the hospitals in the state to understand cutting edge pandemics like COVID. How are people responding? Let the government and public health agencies respond as needed. Each hospital system has millions of bits of data that are entered in, that are used for billing, used for lots of purposes. What a common data model does is really establish, here are the 100 or so variables we really need to share at a state level to understand what's going on with individuals, understand how we can maximize the public health of individuals. So when we think about an Indiana youth legal information exchange, we're not there yet, but to really understand what's happening in our 92 counties, in jails, in DOC, in detention, in diversion, with prosecutors, with police. Eventually, we have to understand what are the core common data elements that we need to understand what's happening to youth across our state on a regular basis. So IHI is kind of the example that I have in my head as we're doing this work and where our lodestar is. I don't know if that's the right term, but where we want to go. How about that? So when we started this work and working with the 6 pilots, the over 20, here are the common data models that we all really focused on. The only 2 other states that we could find that did some work in this area is California and Michigan. So there's some models there, but then each state is very different with policies, procedures, code. Here are the different data elements. So for instance, referral ID. We want to make sure that it's in this standardized format, specific numbers. If it's all zeros, that doesn't work. If it includes alphanumeric codes, that doesn't work. So we need to define these so that we can really understand what's happening to young people. The yellow ones highlighted are ones where we had to spend more time because there's more county and local variation. And then there's been really great work done by the Indiana Office of Court Technology with OMS and RS for linking some of this data that's more recent. So we're super thankful that they're continuing to innovate and do good work in that space. So there's a really important relationship between referral and diversion. You know this. So definition is any written report or document received by probation or prosecuting attorney. So already, where's that data? Who's seeing it first? We see this local variation indicating that something has been done, crime or status offense. This includes referrals received by probation. That's normally what we can understand and locals can see. But then those received and disposed by prosecutors often don't see those. Pre-referral diversion, police and school often don't see those. So we're already missing some of these. And we know from grants received by counties, they're looking at pre and post referral diversion. They vary widely, and we know that ICGI, and we really want to see outcomes from this. So right now you have local agencies gathering their own data, but if we could help with information transformation so that there's more uniformity, that would be a win for everyone. We'd really understand how youth are traveling through systems. So here are some recommendations that we have made. The caveat is this was based on information, working with counties, current status. We all might quibble with some other recommendations. So I think that's where I think the approval will be to receive this report, but there's still work that needs to be ongoing to figure out brass tacks of how to do this. So revise recommendation, operationalize referral outcomes for clarity, continue to develop this common data model across all stages of the justice system. So that's probation, post-disposition, DOC, waiver. I think that work needs to be ongoing, and that's going to take some time and work with individuals. And it means also working with other systems, not just court systems. And there is a continuing need to improve training and technical support. This isn't going to stop. We always have to improve training, technical support. There's lots of local variation here. But there are some things that we can do to have kind of some basic definitions, common data model to communicate across the board. So here's one recommendation, revising this referral recommendation. Move away from informal, subjective, potentially biased language with clear operational guidelines, common data model, more clarity, and more clearly in a single applicable response. So here are some specific recommendations of terms to eliminate, really clarify what they mean, and what this would look like, for instance, as an example, is more this image. So dropping some of these terms in X's, identifying young people that are traveling through. So if it's divert by policy in the recommendation, then we wouldn't need that in the prosecutor action or court action on referral. So this is definitely getting into the weeds. And this would mean training. This would mean a work group to make sure that IOCT, IOCS, local purveyors are on board. This would mean resources, time, staff, and financing on changing some of these information systems. So this would be a lift. We think it's an important lift for us to really understand what's happening with young people. So I've already mentioned this one, this common data model. So who needs to be there? We have amazing support at IOCS as well as IOCT, and then bringing youth agencies to the table, but that work needs to be ongoing. And then that ongoing training and technical support. We heard from counties across the board, they really wanted a data entry model. I think this common data model can inform that because, I mean, there's a lot of turnover at intake. There's a lot of turnover at probation. We've seen more and more, at least in my instance, COVID, turnover in leadership with all of our counties. So if we have some standardization, some video tutorials, that would really be informative. We have some great teams that can do that work. And then there are some other minor recommendations, and by minor, meaning helping with efficiency, it doesn't mean that these are easy recommendations. None of this is really easy, but some recommendations you can go into more detail within the report if you're so inclined. There remain lots of outstanding issues. So youth moving across jurisdictions and double counting there. Capturing decision changes and process variation over time. You can see some sand key diagrams. So that's like where you have the lines going to understand. A lot of our others are simply because the case hasn't been closed. And it's a pain, right? To go back in and this youth and what happened 6 months later. But we really need to know that to understand what's happening with young people. The intended purpose of diversion, statutory requirement is to capture diversion, but what about past diversions impacting decision on future referrals? So right now we have diversions that are within all of these information systems, and you could have someone that's identified by someone as having multiple diversions. So one of the future transformational goals might be this one, a diversion data entry module that's not in the youth's case history. This would be a big lift. This would be a lot, but I think it matches more the statute and the goal of diversion. Yeah, hop in.
What does that mean, that you're not looking at previous diversions for a new case? So you don't look at their history, you do this?
Yeah. So
okay.
Now practically, really, what does that look like? How does that work? We know from counties there are some that would really love to have a separate process. And then there are some. So I think this is one of those where we should definitely have a work group convening across multiple systems to really think about what that reform could be. Good. Yeah. Question. This is one, it's obviously a hot topic across all systems and counties and individuals. We really have to think about what practically should happen on that end. And there continues to be significant data burden on probation department staff. So if we think about transformational change, that common data model is one that comes up time and time again. Could there be a data warehouse, so Indiana Youth Legal Information Exchange, that would really understand the pathway of young people from law enforcement all the way through the waiver process? That's obviously beyond any work that we could do at IU. That's got to be a state level decision of how that could work. Can data be provided back to counties? And this is one where we, in the report, talked a lot about Management Performance Hub. So that agency that sits within the governor's office, focused on data linking for evaluation and outcome purposes, with an end goal of really tracking youth well-being, so education outcomes, behavioral health outcomes. So these were some goals, reaches, suggestions that were lifted up locally that YJOC and I think other deciders at a state level can really work through in terms of, is this something that we really want to see? Is this a feasible goal? If this is a goal that we would like to see happen, what kind of resources would need to be there to really move some of that forward? So that's kind of our recommendations of some next steps. I want to be very clear that we make these recommendations, but it's not really, it's more on YJOC and a separate work to really work through what's feasible, what's important, how would that work. But we think we could get farther along with really understanding what's happening with young people. So would love to have some questions. I think there's a lot of feedback that needs to happen on all of these fronts, but that's kind of the process so far.
I have one more question.
Yeah.
So the data warehouse idea?
Yeah.
What do you mean by that? So I get that data lives at the court, data lives over in the prosecutor's office or over here.
Yep.
So what do you mean by a data warehouse?
I think that is something that we definitely have to work through what that could look like. Let's use the information health exchange as a model. So what that looks like right now is that all hospitals are probably providing about 50 specific variables related to outcomes across the hospital systems that's shared in a very private and well way. So there's a CIO, so a chief information officer, that kind of guides that work along with statutory guidelines and requirements that then is there to really understand how data can be shared more correctly and positively to inform the youth of young people and outcomes. So there's a lot of work that needs to be done practically to understand what that could look like. But that's one example that I continue to go back to, is the IHI example. There are some examples right now of other states that have done this work. So Minnesota right now has done a lot of data sharing around jails and Department of Corrections to understand what's happening at more of a state level. So there are some examples out there of existing warehouses with approvals and making sure that it's all to the betterment of young people.
So it's kind of the idea of taking specific data reporting and Putting it in. Okay.
And putting it in there. And then I think a wonderful opportunity would be some back end data reporting to limit all of probation or other people entering in information. If you could pre-populate some data elements, that would be a win at a local level as well. Great question.
Do you have a timeline for what that might look like? So in other words, in order to shape state level policy, are we talking about next legislative session? Are we talking 5 years from now after a lot more work? What is your timeline?
I think there are some easier wins that are quicker with common data model. Clearly that training needs to happen quickly. There are some quicker wins in terms of reforming information systems that I think could be 12, 24 months. When you get to a warehouse idea, I think that's where we need to have more of that work group decision, goals, what data elements. So I think that would be farther down the road, but I don't think it has to be 5, 10 years, particularly with MPH and then some of the great work that's happening with the chief information officer at the Supreme Court. So there's some more progress now than there ever has been to move some of these goals forward. And Chris is going to wrap us up with kind of bringing us back to the report and some of the goals that we had, and some of those fit well within that. Okay, other suggestions, questions, feel free to email me. Lots to work through, but I'll pass it on to my co-chair.
All right, thanks.
Yeah.
Dr. Alsma sort of anchored us to 1970s. I'm going to anchor us purely at 2023 and the release of the YJOC data report. Just to kind of give an update on after the work that IU has now done, where we stand on the original sort of 7 deliverables that were noted in that original data work group report. The first deliverable, goals for collection, was done once this group accepted and approved that report. So that one was an easy win. Deliverable 2, shared definitions. Where we stand on that is sort of we're partially there with the work that came out of the IU School of Medicine work, things like those referral outcome definitions, the referral recommendations. So we're getting to that point. We're moving along. The third deliverable was standard protocols and procedures. So specifically what it said was to set standard protocols and procedures for data collection and quality assurance, including a plan to track data across the juvenile justice continuum. So phase 1 sort of assessed where we were in 24 counties. Phase 2 piloted in 6 counties, but scoped only to referral and diversion quality, not the full plan. So moving along. Deliverable 4, performance and data measures, not accomplished yet. So the idea of being able to create, and I think Nancy talks about this quite a bit. If you don't, I just credited you with like creating performance measures. But what the deliverable actually said was establish a minimum set of performance and data measures that counties shall collect and report annually, including equity measures. We're not there yet. Deliverable 5, data reporting, establish how data should be reported and to whom, still not accomplished. Deliverable 6 is create a research agenda, establish a research agenda to evaluate the effectiveness of the interventions. Largely not accomplished. Some work has been done, largely not accomplished. And then deliverable 7, costs of collecting and reporting. Determine the cost of collecting and reporting data described in this subsection. It's sort of unknown. It was outlined that the initial cost was going to be the $800,000 between the work with IU School of Medicine and with IOCT and the updates that were going to be needed. Some of those that were initially laid out in terms of we want to do this like a data or the abstract were determined early on. We're not going to do that. That cost hasn't been expended. However, the report then said we're going to need $2 million per biennium to further this work. That's sort of where we're at today, is determining what the next phases are, what the priorities are going forward, how do we continue to move this thing down the road. But then to do the training and technical assistance part of it. IOCS is responsible for the training and certifying of probation officers. So the training part largely falls on us. And that is something that we have been working with the youth justice strategists. They're already overworked with JDAI work. And we have sort of slowly been able to connect with counties outside of the JDAI network. Honestly, we need more folks if we're going to do this effectively. I think Mark talks about boiling the ocean. I think there's the potential that we're going to try to boil the ocean with some of this. It's very overwhelming, I think, when you look at the original data report, but we've made some progress. And so I think next we identify where we want to go next.
Questions for Chris? Do we have a motion to accept the report as presented by Dr. Alsma today? Okay, thank you. Do we have a second? Okay, we have a motion and a second. Any discussion?
I have a question. What do you mean by accepting the report?
Accepting the content of the report with the understanding, as Dr. Alsma said, that there's a lot more work to be done to define the specific recommendations going forward.
So I guess I still have questions about what the referral, some of the finer points are, but I don't know if that's set in stone or changing. Like when you talk about catching referral recommendation and recommendation outcome and like the finer points of what we think we're capturing there. I have some questions, but other than that, I'm good with the report, if that makes any sense.
I think it makes incredible sense. So these are recommendations that we're making. Clearly a separate work group composed of local actors in the state need to work through, is this the right options that we should make to improve outcomes of young people? So I think what I would recommend is to make sure that there are multiple systems at the table to inform if these are the right elements.
Yep, I'm good then.
Any other discussion? All in favor say aye.
Aye.
Opposed, nay. All right, thank you.
Still.
No, Sarah, yeah.
No, Sarah.
All right. We'll move on to the next item on the agenda, and that is the lived experience update. And we have Adriana on our agenda, but she has no voice today. So, Mark, do you want to start, and then I'll fill in the gaps?
Excuse me. I don't either. Does anybody have a voice? No. Yeah, this weather's been a lot of fun for voices, I'm sure. But Audrana has done some meeting and outreach on the request that we start looking at integrating lived experience more directly into the Youth Justice Oversight Committee. I know that's something we added in as a goal of ours a few months back, that we wanted to see where that would make the most sense. We also agreed that after we get done with some of the consolidation with the CISC, it would make a little bit more sense still to make some of those appointments there, since we have some work groups that are shifting and moving and going into the CISC and staying separate as well. So she's had talks with a few different groups and entities on it. We have not gone where we've identified anybody yet, because we're still looking at having some specific conversations about who'd be good for that. Something we learned under the CISC is don't just find a youth that you think would be really good at and say, how about you? Sometimes they feel trapped into a yes, and often they're not fully equipped and ready to meaningfully participate, and that leads to problems down the road where they're not enjoying the role and we see them kind of fade out of it because they're not feeling fully ready to embrace that role. So one recommendation that we did have is often we look at placing folks directly onto the larger bodies like this when lived experience usually doesn't have lived experience in all of the things we talk about. So that can be a very daunting starting point for them. So some of the outreach we're going to do is talking to specific groups that work with specific populations, and then see which ones of those make sense on some of the work groups that we have under the YJOC, instead of just saying, boy, we need to get somebody on there, and this person said yes. We do have the ability now that YJOC is under the CISC to compensate them directly for their time and make sure they're fully supported in that. We have Adriana's position now where they'll have that single point of contact, which is always best practice, to say who's the one person that's looking out for them and just them. So that's a good and exciting thing that we have looking forward. So really next steps for us are if you have direct connections with some of those entities that have done some of the priming work, at least with getting them used to being able to speak and be part of groups like this and not feeling overwhelmed by the process. I know she's reached out to you, Kia, and then making sure that they are, once they have specific expertise that they would like to share and integrate into the work we do. That's something we're looking at, I think, by the end of the year, at least starting to roll out where we're soliciting more directly some youth to join our work here.
So the outcome that we're looking for here is to have a person with lived experience on each of our work groups, behavioral health, doing that frontline work, grants, etc. Data.
Yeah, and that's an important part where it is to remember too. Sometimes we look purely at their lived experience in state systems rather than somebody that has that experience, but also has an interest in the work that we're doing specifically. And we work with a lot of young people who have actually moved into roles with state government and other things where what they're doing isn't maybe what their lived experience is about, but that's what their awakening was, to say, I want to get in there and make some change. And believe it or not, there are some young people that like things like grants and data. I was not one of those, but they do exist out there. So even thinking about some of our academic partners where they've had some internships, they've had some work, they've been embedded for a little while, but they also have that specific lens of lived experience so they can be our checks and balances as we talk about those topics. That's what we're really looking for there. So more of planting the seed now to start thinking about where those connections are. And it almost always works better when they're also working with another organization or entity that can provide that background support and make sure that they've got kind of that network supporting them beyond us. As much as we'd love to be the support, everybody needs supports beyond just that group that they're coming to a few times a year.
All right. Any questions for Mark? Nancy?
I just want to remind all of us that the diversion work group still exists. It's not active in terms of, but especially with the young people, the toolkit that was developed, they meet at least annually now, maybe semi-annually, to do updates. And like the toolkit, I think would be a really good place where some young people might be able to have some input on, is this even, I think there was some, initially in the diversion report, there was the group that convened around that. But going forward, making sure that that work group is still considered as part of the group that.
Yeah, I think that's a good point too, because another thing that I neglected to say, specific roles and projects help a lot. I've never taken a job where they're like, well, we'll figure out what your job's going to be after you're there, but we think you'll be great with us. We've really got to dial that down. And some young people, especially really busy ones, would rather have that one project that, okay, twice a year, can you come in and help us review this? Others will want a more ongoing role because they're looking at a professional relationship that they want to build and grow and learn more about what we're doing in state government. So definitely think about what specific roles you have that could be beneficial for them and for the YGOC, so we can make that approach a lot more cleanly and make it something that isn't so overwhelming. They're saying, I don't even know what I'm signing up for.
One other question just came to me. Would this group be able to do something that was more general too? So, for example, the play and bounds, it's a document that we at IOCS has paid for. We have a partnership with DMHA. They paid for some printing of these, and it's basically a guide for young people in the system. It needs some updates. And we don't have any funding right now for that, but thinking about how we could maybe have some youth review that. There's some legal updates that need to be made that are outside my scope, but then there's also like, what is the right language? Even the graphics on the booklet, I think, are a little old. So would they be able to do some of that? That's not necessarily directly related to a work group, but it would be definitely a specific project.
Yeah, we've been more so with that, where we found the general items where we just want some youth to look at it that can dust it off for us a little bit. So we formed a voices committee that is kind of collecting from all of our different work groups where we have lived experience. They're often the ones vetting those things at the broader level. But I'll also say a lot of times they're also saying, like, are we the right group to vet it, or is there an outside entity we should really be connecting with that specializes in exactly this topic area? Because one thing we always make the mistake of is we want to be the one expert answer for everything. And there's a lot of people with a lot more specific expertise already out there. We don't need to always pull them into our group. We need to build a connection with that group. So I think that would be the starting point, would be the Voices Committee, and then they can look and say, are we the group to do it? Or do we connect with a group that'd be better at doing that?
Thank you.
It's a great idea, Nancy. Yeah, Judge King. She has laryngitis today, but Mark, do you want to share?
Audrina is our engagement coordinator. Yeah, under the Children's Commission, and she hasn't been able to be at too many of the YGFC meetings, but she's the person that is our staff point of contact for all the lived experience work we do. So we brought her on a little under a year ago, and she's been working and making sure that when we have youth representatives on the commission, on our workforces, and as we look at adding them to YGOC, that they have that one person that is their person. And we found that to be really, really valuable, so they don't feel kind of lost in the mix out there. She's also developing the plan for how we do this work and how we bring them in appropriately. And she was going to present today, not for the loss of voice, so we'll get her in here soon.
For the diversion committee, do we have, Tracy, do you have a timeline for that? So do you know when that annual meeting's generally going to happen?
It's probably going to happen in the fall. And if we need one more often, there'll be one in the spring also. It's kind of what we're talking about right now.
Okay, thank you. All right, any other questions regarding lived experience? All right, next item is the CISC update. Mark?
I always feel like I talk more than planned at these meetings every time, right? So plenty going on with the CISC. Of course, we are, as much as I feel like I just stopped talking legislative affairs, we're gearing back up for that season again with things that are going on. I will say that we are getting prepared to open up the legislation on the CISC itself to make some tweaks in there. I don't see anything specific on Youth Justice Oversight Committee, but I can certainly pull out that section of code if the group wants to look at it and make sure there's no tweaking to do. We've made some adjustments over the last couple of legislative cycles in there. So about half, well, maybe 2/3 of the content in code about Youth Justice Oversight Committee is everything that we did prior to getting that initial report out. But the tiny paragraph that's left at the end says, well, review and implement things in the report. So we kind of need to keep that in code, or it doesn't really have anything to refer to. But I always worry because when you have stuff like that that has a date stamp on it, every now and then the legislature wants to come in and just cross. But I don't see anything that really needs to be removed from there at this point. So we're not going to open up that can of worms just yet. But again, something to review. The important item within that is that it does have the Children's Commission expiring January of 2029, which seems like a ways off, but it really isn't, since 2027 will be the next legislative cycle. And the one after that will actually be halfway into looking at 2029 when things would get implemented. So we'll be putting that out this year. Nothing to be scared of there, promise. We'll bump out that expiration date somewhere, usually between 8 to 10 years is what they like to do. So that's one thing we'll do in there. But piggybacking on our lived experience talk too, we also had the Voices Committee that I referenced that's under the CISC that's made up of lived experience individuals have recommended that we take some language and change it for the charge that's under the Children's Commission, and that is the phrase vulnerable youth. It defines in there a few times vulnerable youth as basically youth who has been involved with one of the state systems for a certain amount of time after a certain age. The issue there is, as you might guess, that a lot of our lived experience folks didn't really enjoy the term vulnerable being used to describe them, especially as adults and after they've exited the system. So they've looked at that and actually had some really good suggestions saying, like, you know, you put vulnerable youth in there as what we must be in order to serve on the commission, and then you define exactly what the criteria are for that. Why do we need that label if you're defining it anyway? To which we agreed and said, you know what, let's take that out. Also, it doesn't cover prevention that way. And even in this group, as we've talked diversion and things like that, we're getting more into that prevention realm versus ones that are actively involved in systems. I'd say, I mean, we're approaching, even in YGOC, half of the populations we're talking about are the ones that maybe are not actively in that system, and we're looking at all the other alternatives, right? So that will be a small change we put in there. Also, we've had interplay with this group and with the CISC looking at social media and online safety issues, and some of the online behaviors that have led to criminal charges and things like that. So we are going to expand one tiny piece of the code that talks about social media and online safety in regards to crimes against children. We're going to expand that to say also their developmental and mental health needs, because we've kind of really left that part out. So to think about, what else could go with that, or installing protective factors and other things, I think we're still workshopping what that little bit of language would be. I'll be presenting at the CISC next week, which will be a time where we'll get more feedback. But if you have thoughts on that, it is one of those words matter things. When I start adding words to a list, I want to make sure we're not backing ourselves into a corner. But I think the dialogue in the state has been a lot stronger in the last couple of years on, hey, we need to look at it beyond just are crimes happening to the kids? What vulnerabilities are we creating? What mental health damage are we creating? How are we hurting their educational development and everything else? So it's really time for the CISC to have some wording a little bit more specific in that zone, which would then trickle down to kind of how we're empowering this group here too. So, so just a few things we're looking at as far as how we would tweak that through. We're really going to focus on with the legislature saying, hey, that vulnerable youth phrase doesn't make any sense for all the preventative work that we're doing. Let's get that out of there. I'm hoping some of our lived experience youth are up for the challenge of actually wanting to testify and be directly involved on that. And again, if you represent a group or with a group that would like to be a part of that, would like to give that opportunity to your youth, let's line up and do that. I always rather it come from the people that is impacting than myself. So that'll be a big one. We'll also be bringing back from last year. We had a bill that wasn't able to go anywhere because that's crazy fast session on guaranteeing visitation for youth in secure detention. This was the one that said 2 one-hour visits per week would be the standard, and that you need to document reasons if that did not occur or could not occur on the request of the parents of the youth or the facility's needs. So we'll look at bringing that back. We're hoping we can get our same authors to attach to it again and have more than the 5 minutes or so we had last session to try to get a bill moving and through to do some good work on that. It had no actual opposition. It just didn't fit in the legislative calendar, which is almost a good thing because that means it didn't have like a false start kind of thing and then got pushed back. It just really hadn't gotten heard and didn't get the attention there. So that would be for youth in secure detention settings to be able to have just that, a baseline standard of how many visits and of what duration they can have per week.
From the parent.
Yes, the parent, and then it talks about other specific adults that would be in that role too. But it's not just anybody. It's not their friend or girlfriend wants to visit or anything like that. So it would be somebody that's in that caregiving relationship. So, and we do have that drafted out so I can share that in advance of the next meeting as we're looking at it, if there's any more tweaks that'll happen with it. After that, legislatively, there's just a couple things to watch out for. They've started scheduling the interim study committees. So a couple of note that are on the schedule. Public health, behavioral health, and human services will be on August 25th at 11:30 a.m. These are all viewable online. So even if you want to just get kind of that feel of the discussion in the room, they don't have their agenda out yet, so I can't tell you specifically what topics for sure will be covered. But sometimes it's just good hearing what word choices they're making, where their interest seems to be going, what they're gravitating towards a little bit. So when it gets closer to session, we don't feel like we're as much reacting and figuring it out on the fly. There'll also be corrections in criminal code on August 26th at 10 a.m. So similarly, they'll be at the State House, but you can watch it online just as easily. Those are usually in the teeny tiny committee rooms, so sometimes I recommend watching them online so you can actually not have to take too much out of your day to do that. There will be one more on fiscal policy that's not been slated yet, but that one does have a topic that came out of legislative session about looking at leveling out and possibly expanding the CASA programs across the state. So very interesting to see where that one will go. Has not been slated. Sometimes these committees don't happen. Sometimes they happen very quickly. So I will keep everybody posted on that as it gets scheduled, because now's the time of year where I'm refreshing every 10 minutes to see, okay, did they schedule yet? Did they schedule yet? And then same as that will be the child services one that I also sit on that goes over child fatality reviews, a lot of risk factor dialogue that comes into there for sure. Has not been scheduled yet, but I can keep you posted on that. And of course, I sit on that one. So if there's thoughts that I see from YJC and from CISC that need to be interjected there, that's where we luckily have a little bit of an inside game to do some of that. So those are my biggest ones on legislative items. The last item I have somewhat in that vein is Youth Justice Oversight Committee does have in legislative code where we're supposed to make an update on our progress on our deliverables once per year, September 1st. We've traditionally done that as more of a collection of the report outs that we've had from the individual groups. It doesn't have to be, it's not labeled as an annual report per se, but something where it's more summarizing our activities throughout the year. So if anybody has specific thoughts or wants to look at making that a deeper dive, but I think we usually are really good at getting those summary reports. So compiling those, turning those into a shared document and getting that posted out to the legislative portal that they have for that would be the plan.
Questions for Mark? Nancy?
One question around, I think that there is a requirement for the grants work group to submit an annual report. And then there's also a requirement for CJI to submit an annual report about the grants. Is it possible to maybe tweak that legislation so that we don't, I mean, we basically report the same thing?
Yeah.
That'd be awesome. If we
And there's some timing variation in how they have it now. So obviously we can't change now, but looking forward, I think some of it is more, when we talked to CGI before, they felt some of it was captured already in some of the grant reporting that they do in their broader package. Now the grants work group and reporting on that and the discussions on the funding formula, if we can get that aligned so it's the same timing as this September 1st report, since as we just said, that's where we're going to collect those reports anyway. I think that makes a good amount of sense. CGI, their process is up to them as a point, but if they wanted to staple that to the back of that same report and we change the dates there, that's more of what makes sense for them, or if it's captured in their bundle of existing reporting that they already do.
Any other questions?
Mark, I wonder, is it possible to get a look at the bill regarding visitation, required visitation with the children in secured detention, please? Is that something that can be distributed at this point?
Yeah, I have the bill that was created last year, and we're now looking at substantive changes on that. And we had the association for those facilities look at it and review it and get the language to what they thought was feasible. So I can easily, after this meeting, send that out. And I don't think we're looking at making dramatic changes from what was introduced last year. So that's an easy.
I have in the back of my mind, well, thank you for doing that. And I have in the back of my head that there was some discussions going on about what if, right? What if this doesn't happen? What's the repercussion? Is it a release? Is it a due process concern? Is it a lawsuit for the detention facility? Those types of things. Has that been built in?
Yeah, there are some safeties built in, and the main thing is it doesn't put a lot of pressure as far as repercussions. It's more about making sure you document those reasons, and that's where a lot of the discussion in the bill ends, is saying if you document the reasons for it, then that's understood. So we're not trying to lead them into something that becomes antagonistic from the start. We're just saying, hey, we realize there can be barriers to visit. We don't want them to be arbitrary. And if you have to take the time to document and give the reasons why, we're hoping that alleviates some of the need to get into any kind of punitive actions.
Thank you, Mark.
Any other questions? All right, then we will move into priority setting. You have about a 7-page document that was sent out regarding YJOC planning priorities. So this is a compilation of last meeting's great brainstorming session that we did here. So we asked each member to bring your top 3 priorities from your communities, your areas of expertise, and throw those ideas out to the group. And then thanks to Nick and Chris, they compiled them into this loosely grouped topic worksheet, if you will. So we have the first several topics under data, potentially data work group, the next several topics under grants, the next under behavioral health, and then other and potential new work. So between last meeting and this meeting, I asked for members to take a look at this list and see if you know of any other group working on these priorities so we are not duplicating. Mark has gone through and looked systematically at the areas and identified several that may overlap with Children's Commission work groups. And so the way my brain works, I'm trying to figure out how to coordinate these things. It would make sense for us to identify those areas of overlap. And then perhaps with the work group co-chairs, I'm happy to help with that, reach out to the chairs of those other groups and figure out exactly what the work is, what work is being done, figure out how we can coordinate, or if they're taking the lead or if our group is taking the lead on specific tasks. So we are not duplicating or working at cross purposes. And then with those other areas, this group will need to decide, are those high priority such that we need to create another work group to take on these tasks and to address these new areas? Or are they lower priority and should go farther down the list? Or are they something we want to cross off altogether? So for today's purposes, I will first ask the group, have you identified any of these listed action items or issue areas that are being addressed by other groups, to your knowledge? Okay. Then
I'm sorry.
under,
Now, this is
yeah.
Judge Graham. I couldn't hit my button fast enough to unmute. IJA and the Indiana Council of Juvenile Family Court Judges are often monitoring legislative bills, et cetera, and needs. I don't know if that's,
okay.
I'm not sure where that would fit in here, but I know that there's two separate kind of bodies that are constantly monitoring that.
Okay. And Judge Graham, do you know this coming session, are they going to have the Friday meetings? There was a small group that was meeting virtually each Friday to sort of look at what's popped up in the last 7 days. Do you know if that's going to continue or have you heard yet?
I do not know for sure. I have not heard about convening that on a weekly basis yet, but I do know that apparently there's also a work group that's been established to specifically address legislation surrounding expungement, automatic expungement of juvenile records. And that's through Office of Court Services. I believe Mindy Pickett's spearheading that.
All right, great to know. Yeah.
On the gun violence intervention, there are tons and tons and tons of local work groups, specifically in Marion County, that are convening and working on this. I don't know what that means of getting in connection with them. There's the Reentry Coalition, there's the Youth Violence Coalition that's headed by our health department. And kind of what we see is what we talk about here is that no one is talking to each other, that they're all independently working towards the goal of gun violence reduction. And similar to what Dr. Osmond was talking about with data, even voices being a part of some of these groups, it is very difficult for us to get enough data to say, hey, our intervention is working. IMPD, we need data. Probation, we need data about all of these gun violence things, and they are not sharing with each other. And so some way from that to come from the top to, because it's what we keep hearing, it's liability, right? It's liability on why they can't, probation can't share with IMPD. IMPD has liability of why they can't share certain things. But then an agency like mine, we're doing a project called the Youth Violence Reduction Initiative, right? And so I'm working with probation, I'm working with IMPD, they're all making referrals. We're working with parents, but it is pulling teeth to get enough information for us to be effective. And so if there is a way to raise that to this group, that would be super helpful on the ground. And so I don't know what that would look like. I'm very open to kind of talking through that. But there are several agencies working on the exact same thing and are not talking to each other and do not have the data to support informed decision making and those kind of things. So I would love to see that raise a little.
Okay. Is that something, Kia, between now and the next meeting, you could get us a list of maybe the group and who's in charge or who's the chair of those groups?
Absolutely.
So we can figure out the scope of what's going on. Are there other communities working on gun violence as well? I know Tippecanoe County has grant funding with a new for a new program that they've been doing.
Yes, it's the handgun intervention program.
County Juvenile Probation has a safer, what we call Safer Streets
Mhm.
program that we've kind of stolen a little bit from FACE program, but also utilizing some other programming details as well. We are doing some partnerships with some of our local hospitals coming in and doing presentations, working with the kids, but it's not like a coalition work on violence prevention. It's more, this is for probation kids.
Sure. And Dr. Alsma, IU has a program as well.
Right. Yeah.
Okay.
Yeah, and I know Elkhart. So I think there are a lot of partners across the state trying to tackle this.
Okay. Any other areas of potential overlap, Catherine?
I don't know that we're really working on it, but Mark mentioned this. I think that there is one representative who's looking at Gal Casa in the fiscal, I think, interim study committee that hasn't been scheduled yet. And we've provided her with some information on funding and other CASA issues. So I don't know that that really qualifies as we're actively working on it, but we're certainly providing the legislature with some information about how funding could be used. And
okay. Nancy?
The Multi-System Youth Task Force under the CISC has a subcommittee largely titled something along the lines of incorporating the science of adolescent brain development into system responses. And one of their priorities is the minimum age for justice system involvement. They've been working on that for a couple of years.
Okay. Any other overlapping areas?
But also say the was a bed shortage. There is some local work groups dealing with emergency shelter cares and those kind of things in Marion and Vigo that we're aware of that I can also send as well.
Okay, that would be great. Okay. Next, I'll turn to the work group chairs and ask if the items listed under your area make sense for you to consider. At the last behavioral health work group meeting, I sat in on that one, and the work group took the entire brainstorm list and talked through them and put them on whiteboards and had members of that work group go and put their top 3 choices and sort of prioritized areas that seem to be rising to the top, the most critical issues. And I think a couple of those areas, there may be some overlap with other committees, so we'll need to look more into that. But the 3 that came to the top for the behavioral health work group were THC cannabis use among youth. Family parental engagement was a very popular one as well, and system coordination. So those were the 3 kind of broad topic areas. And then there were a good number of other issue areas that got several votes. So I think there will be in the next couple of meetings, YGOC meetings, give and take between the work groups and this full group to figure out the broad path. But we need input from those work groups to let us know what the expertise in the room says are the most critical areas. And then we can discuss those broad areas in this group. So figuring out how to steer the ship going forward from here. So data work group, we had legislative change tracking, case information, and early assessment tools data quality and system alignment, and expungement and data access. So Chris and Dr. Alsma, do those sound like?
We didn't have time to really talk
Mhm.
these through at our last data
Mhm.
meeting. I'd say the last three, yes.
Mhm.
I think the first one is one that I would have more questions about, and
Okay.
particularly if there are judicial teams tackling some of this tracking. Chris?
I kind of felt my initial notes on that one were yes, after the identifying part is accomplished. So I think I think Judge Dolahanty made this suggestion, and so I think we need to actually identify some of the potential legislation that we would want to start tracking and what the outcomes look like. I also think Judge Dolahanty's intent was also to see what can be done where either the legislation is causing poor outcomes or is just not useful.
Mhm. Judge Dolahanty, do you want to say any more about that today?
Yeah, well, I do actually, and Chris summarized things very well there. The other kind of related topic to it, though, is and Judge Graham brought up the IJA, the Indiana Judge Association, and the Juvenile Council as well. Both pay attention to proposed legislation as it comes through the session work, right? I tend to think that's something that the legislative branch is going to look at as this is what the judges are driving, whereas opposed to our group this morning is a creature of the legislature. And just inherently, I think carries clout, or should at least carry clout when we would go to testify perhaps on a particular bill that the legislature or committee of the legislature is considering. That, we are they at this point. And so I just tend to think that that should carry extra credit with them, as opposed to, well, it's a different branch of government that's trying to push forward their own agenda. This is a legislative group that's going to the legislature to say this is why this is a great idea, or this is why this is not such a great idea on a particular piece of legislation. But the main parts of the where this fits into data is what Chris summarized earlier. Try to identify, for example, the changes in termination of parental rights. Right, it used to be there were basically 3 different ways you could terminate somebody's parental rights, and now there are 300 by exaggeration. Different ways that can be pursued. Is that working? What's the impact then on the children, on the families? Are we getting to adoptions? Are we getting to permanency earlier? If there's some way we could pick out those big legislative changes and see track for the legislature as a favor to them. This is working, this is not working, this is where it might be tweaked.
Judge King?
The new legislation, I'm actually kind of interested in legislation, especially legislation that is just bad for, and I understand kind of what Darren's talked about, this committee being with the legislature, having derived that, and then as far as the judicial committee. But I also think it's important to hear what this committee has to say, and then take it to that committee and say, well, and kind of work with both of them, because what I think might be a problem, I agree with Darren when he says, it went from 3 to 3,000. It seems problematic there in the termination. There's parts of that DCS has probably never used and will probably never use. So that as an example could be something that could be honed in. But I think it was also be important to see what other judges on that committee said. Well, I'm thinking most of this doesn't work. Does anyone have a different opinion about that? Oh no, in Tippecanoe County, we use this section all the time. Oh, better back on that. Might be something that is being utilized successfully and for the right reasons under the right circumstances. So there's that. Just if there are issues legislatively, certainly I enjoy it. Work with Mark or whomever maybe try to work on some of those avenues from a judicial standpoint perspective too.
Great. I heard a volunteer.
Go again.
Other discussion regarding these 4 topic areas? So it sounds like we're okay saying 2, 3, and 4, Data work group will talk about those and what to do with those, and then have a conversation with the full YJOC going forward. Okay. Under grants work group, we have sustainability of programs and funding, shared funding with the child welfare system, resources and technical assistance for grantees, funding mapping for existing streams, evidence-based program funding, MST and similar models, mental health services funding quality, funding for public defense, funding for GalCasa, and funding for mental health spaces and facilities. Any of those don't look like the others? Any of those you would kick out and say, no, that doesn't fit the data work group?
So we had.
Grants work group, I'm sorry.
No,
Mhm.
Our last meeting, we were pretty focused on our getting rid of our
Mhm.
caps. So we didn't have a huge amount of time to discuss these. I know that we did have a lengthy conversation regarding sustainability, and I think that it's Doug's position, and I think kind of the consensus of the group is that under current economic conditions, it's something of a, I think you used the phrase pipe dream. To expect communities to be able to come up with adequate funding outside of grants and state funding for a lot of these programs. So Doug's position, and I think the position, I can't speak for on behalf of the ICJI, obviously, but I think their position is one of the reasons that we want to reset these caps to zero is to promote the sustainability. So I know that is a topic that I think that we're gonna continue to explore as kind of our number one. And then the technical assistance for grantees, that obviously has to be a huge priority for us. I mean, we've all kind of discussed the fact that we have this pot of money and we're trying to shove dollars into people's hands and they're doing this not it thing. So clearly there are barriers to people taking advantage of that. So that was another priority, I think, that we identified. I'll be real honest, I don't think we really had a chance to discuss some of these other ones.
I would just say, I think the last three are really outside the scope, the funding for public defense. I don't think that falls. There's a statutory language that says that the CJI shall serve as a pass-through to counties or pass-through around these funds. So I don't think the first two may be part of the third one and under behavioral health, but we're not in a, we've never been good fans of funding buildings. So I don't know that that's the right thing to do with the grant money, but definitely the public defense and the GalCasa program, I would say as the staff to that work group that falls outside our the original intent.
And I would.
So one question on process.
Yes.
So if the grant team continues to have a discussion on these and come to the conclusion that these are the three priority items we can tackle, the other six aren't really priorities, would that be an acceptable outcome?
I think that's perfectly fine. Yeah, so we can say parking lot over here. We'll put these ideas on the back burner and come back to them. But right now, these are either low-hanging fruit that we can accomplish pretty readily, or these are critical. Our communities really need help in these areas. So for our grants group, are you willing to take this list back to your next meeting and have a conversation and bring back a report or include it in your written report next time? Your thoughts? Wonderful.
You said the last three, I agree with Nancy. I think the last three.
Yeah.
They're out.
Sure.
But the other six, we still have six to pick from.
Sure.
I guess the top one I'm still preferential to. Sustainability seems to be key.
And concur. It seems like funding mapping existing could include MST. Like there's some that could. So I think there's some consolidation that could happen as well. Yeah.
It's still.
So we'll carve out the last three. The rest will be the grants conversation. Okay. For behavioral health, they have identified, Mark has identified rather, several that there is potential overlap. So since we don't have Sarah or Magistrate Gowdy here today, what I will do is reach out to them and have a conversation about how we coordinate with those other groups, whether that looks like a co-chair virtual meeting, conversation, something like that, or if I can facilitate that in any way. So we'll get more information on what those other groups are working on. But I think that the general consensus was that these all have overlap with behavioral health. That's just a huge work area. So I think they all fit in the topic. It's just now narrowing the field for what's next. Dr. Alsma.
I think one other suggestion that I'm still trying to wrap my head around is the rural health transformation IDOH work. And there's a lot of work groups on workforce development, paraprofessional, peer recovery, certificate program, university partnerships. It's kind of astounding. So I know Director Sailors is involved. So I just think there's some significant overlap and significant resources going to some of these areas that would be helpful to clarify.
Okay. Is that something you can help me with?
I'll try.
Okay. All right. Any other input on the behavioral health list? Okay. Then we'll move on to other or potential new work. And these items didn't fit clearly or obviously into the existing areas. So I'll throw these out for conversation today. We've already had some conversation regarding gun violence. So that looks like something we need to gather more information on. The first item on that list is secure detention bed shortage, facility staffing, and data. So Dr. Alsma, you just mentioned there's a lot of work going on there. So if you could help us gather that between now and next meeting, that would be great. And Mark, you also highlighted prevention side. There may be some overlap on the gun violence as well. Minimum age for justice system involvement. Liz, you brought this up at the last meeting, and it sounds like that piece of legislation is going to come around again. And I will put that out there as a good example of the good work that can be done in a multidisciplinary group like this, because a work group from CISC took that topic on. The interested parties sat around a table and kind of hammered out the details, brought it to the full Children's Commission. The Children's Commission had questions and sent those questions back to the work group and said, bring us more information. They gathered input from detention center staff, managers of detention facilities, and asked questions like, how is this going to affect your processes here? IPAC, public defenders. So do you recall that, Tracy? No?
No, I don't.
Okay. All right. So it was a big conversation in the CISC meeting and concerns around the table. So I think that's a good example of multidisciplinary work and how it can happen. And Tracy, this go round, let's make sure you're in that.
No, I was on.
Loop.
I've been in the meeting.
Okay, all
Actually,
right.
I don't think I was at the last.
Got you.
But
Okay.
Chris Naylor's.
Got you.
CISC,
Yes.
So that's why.
All right. The next is legislative priorities. So this is that first. We have that also under the data work group. I'm hearing from this crew that may be a natural new priority work group. Does anyone have input on that?
That was actually going to be my question, is whether or not this group has an appetite to create a work group that would be sort of legislatively driven, focused, I guess.
I see you looking at Judge King.
I always look at him because he always looks like he's going to say something like that.
I would probably, as far as the judge's advisory committee, would be dealing with this issue anyway. Well, if there's something that arises, now I don't know what the scope necessarily of this, since we haven't come up with one yet, this committee on this board would be. But I definitely want to be involved just because there's just gonna be so much overlap.
Mhm.
And I think maybe this might be a situation where, it might not be a bad thing to have multiple entities. This is, this board is set up legislatively. That is created traditionally. If A and B don't know what A or B is doing, we're going to get a lot of things that probably a lot of judicial officers are going, what? And then appellate judges, for instance, might feel the same way as something like, why is this happen? So I'm good with whatever group decides, or if, however I need to be involved, I'll be involved.
Okay. And I will mention that the Children's Commission has a structure around legislative agenda. So in other words, we have multiple disciplines around the table. And so we may not all agree. And so we need to be very clear about what this group as a whole supports, what it doesn't support, what it can't support, because there's this agreement. So we do want to respect one another's roles in this multidisciplinary venue here. Any other input on the legislative priority? Anyone think we should not pursue that as a separate work group?
I might. So I guess here's the question.
Mhm.
There's so much work to be done.
Mhm.
If some of this work is happening well in terms of existing committees within existing agencies, are we duplicating that work? Or do we need to have this here because there's multiple components like the data piece, some other elements? So I guess that would be the question.
Yeah, I can jump in just on how the Children's Commission's done it. So we don't have a separate legislative work group. We have where recommendations will come from the individual work groups where the light bulb goes off and they say this needs to be legislation.
Okay.
And that's where that goes through the entire process with the Children's Commission, and we introduce that and we turn that into bill and everything. However, that would bubble up from the YJOC. It would still go through that final polish of having the full Children's Commission look at it if it was going to become something that we're endorsing as an entity. Now, if we're talking more about information sharing and just thinking about things that we want to keep an eye on that might become one of those things, that's a much easier group to have and to form. It's when you get into legislative action that we've got to be a little bit more careful.
I like Judge Dolahanty's characterization of offense and defensive positions. So part of this is how do we move state policy forward to do better work and serve youth better. And the other is defensive. So when that bill pops up, do we take a position? Do we speak up? Do we let it lie? Those sorts of things. So I think it's two-pronged approach there.
Good.
Other questions? All right, so I'm going to put that on the short list for new work. Next is a mental health provider pipeline, university partnerships. So Tracy, you identified a shortage of mental health providers willing and able to work with youth in particular. I think that's a big one. So this may fit within behavioral health. We could maybe slide that under their list for consideration.
We're absolutely seeing the same thing. For us, it's not a shortage of providers. It's a shortage of them willing to be in person. There's tons of therapists that are willing to do virtual work, but with the population that we're working with, sometimes we need that in-person stuff. And I can't find any. They're all wanting to be virtual. And there's like,
And there's the cities. Think about the
yeah. Yeah. So
no-
I don't know what that looks like, but it's a huge, huge issue for us. We have to on our staff, but to fill the capacity and the demand that we're seeing, finding therapists to be in person to work with DCS populations or probation populations, we have not been able to find any.
And Kia, when you do, do they specialize in kids, or do you just have to take whoever's going to be?
It's honestly, we've been taking whoever we can get.
I remember that from being in court all the time.
Yeah.
A lot of times that was definitely just a huge barrier to what we were trying to accomplish. So.
And what we're hearing is because of legislation, or I don't know if it's legislation, but policy where they don't get compensated for mileage or those kind of things, that they're driving to see clients, specifically with our population, if they're canceling, those kind of things. It's just turned into we're only doing virtual. There's a whole pool of therapists that'll work with them virtually, but in person, it's pulling teeth.
I want to go to school and be a therapist now, so I can like get certified. That might take too long.
So the Bowen Institute, which is a workforce institute at the School of Medicine, just convened a group, national group around paraprofessionals, community health workers, bachelor's level. We're doing more of that training statewide because it's more feasible in rural settings with strong supervision and strong treatment. So I think there needs to be more innovation in this space. And that could be an example of some work.
Okay, so it sounds like we have effort, Bowen Institute. I've made a note of that. Nancy?
Judge Kennedy, I just want to, in this particular one, I feel like it definitely fits under the behavioral health worker. Their original task was to develop a plan to address the behavioral health needs of youth encountering the justice system. And I know that their original report had some things about, the diagnostic evaluations and those things. I don't know that it ever met the broader plan, and I feel like this fits directly into that.
Okay. Does anyone disagree with that? The mental health provider pipeline would fit within the behavioral health work group's charge. So we will let them know that we're adding that to their list, Chris, if you'll make a note of that. Next up, pretrial and post-trial options for waived and direct file youth. So Judge Broadwell brought up this issue. So you have young people who are both kind of pretrial and post-trial, very limited options on both sides of that. And she wonders if there's a systematic way to look at how we handle these kids who are either direct filed or waived to adult court, and what services look like for those young people who fall kind of in that middle between the two systems. Thoughts about this one?
Yeah, I guess I'm not sure what she's saying as far as what options for secure detention, or options for treatment, or sentencing options. I'm not.
Okay.
Because she's talking about juveniles in adult court, right? Whether they're waived or direct filed. So is she saying that I'm not sure what system differences she's looking at, I guess.
Okay.
So I would want more specific information about what she is wanting to see.
All right.
Whether it's community corrections or what options she's asking for, or if she's just saying they should stay in juvenile court, which is a philosophical difference. And, legislatively, that'd be a big lift, but I don't know if we get consensus at this table for that issue.
Okay.
What we've seen is that youthful offender, from when they are away from from juvenile court, and they're released on maybe a community corrections, the availability for a therapy referral, case management, mentoring, or something like that is not an option because they're now out of juvenile court. So we can't have a DCS referral, and then there's no mechanism on the adult side to provide those services if they have not been convicted of anything yet. And so we have this pocket of young people that are anywhere from 15 to maybe 19 that have been waived to adult court, but there's no services. Like, we are in the Marion County Jail working with that specific population. And it is like this middle ground where we can't ask DCS to put in a home-based case manager to help navigate anything or therapy because they're not tied to any system yet. So when I read that, that's kind of
what 20 and 23-year-olds in that same situation. They just don't do anything.
I think once they're convicted, then they have more options. But as we're waiting pretrial and those kind of things, there's not. In juvenile court, they have those options. They put in supports to kind of help them get to a better space and navigate through that system. That there's just not for that holding time. And that's what I read into that. I could be wrong though, so it would be helpful to have some clarification.
It sounds like adult court is lacking services that you wish that they had. Is what I'm hearing. I get that you're trying to make it only, or not you, but Judge Broadwell or whoever is trying to make it an only juvenile issue, but it just sounds like a system issue on the adult side to me. If it's something that you think needs provided to adults that need that help, that's a completely different issue. I mean, I get that we're trying to say that it should only apply to like people who've been waived who are 15 to 18 or whatever, but obviously maybe there's people in the jail that are 23 or 24 that also would benefit from that, right? So I see that as just a philosophical issue about waiver, but I mean, I get that everyone's coming from different places in the system, and whether it's something you think the system should provide or not provide, I'm sure is a money issue when it comes down to what we do in that space.
Other
That might
conversation.
pull into the young adult court, which is down here in a minute. So you can get your problem solved.
Other input on this item? So it sounds like we need better definition. So let's reach out to Judge Broadwell and ask her to provide better definition for what she's thinking on this item. And we'll chat more about that at the next meeting. Next up, determinate sentencing for juveniles. So Tracy, this is your item. Do you want to say more about that?
Yeah, because this makes it sound like I think we should do away with it, which is definitely not what I was saying. No, I was just making the point that if we are keeping more dangerous juveniles or those with more violent histories, if you want to make the argument that they need to stay in juvenile court or they shouldn't be waived, we don't even have, although there's a determinate sentencing statute for the most violent of those youth, it's unusable because of a case from 2012 from the Indiana Supreme Court. And so it literally needs like one tiny phrase struck to make it useful, but that hasn't been done legislatively. And so a judge cannot have a guarantee that if they keep a juvenile murderer that we can give them a determinate sentence. And I get that DOC doesn't particularly love those, but we also know that they don't want to keep anyone over a year. So if you're going to ask us to keep a very serious offender, I think that needs revisited.
Okay.
That's what I was bringing up. I don't know if anyone else really has the appetite for that, but I'm telling you, it's a really hard sell to get us to keep I mean, obviously we want waiver in those situations.
Okay. Other input on this item?
And it's all because when they created the sex offender registry,
Mm-hmm.
it references that. It says after making a finding under 11885,
Mm-hmm.
but then it lists crimes that aren't sex offenses. So it was just a mistake that it got added and it's never been removed.
So would this item fit within the legislative?
It definitely would be, but once again, I know that this group doesn't always have the same opinion on those things. So yeah, it would be something I would raise if allowed.
Okay. Any other thoughts on that? Does this fit within a legislative conversation? And we're not talking about we're pursuing anything. These are items to be assigned for discussion and study. Okay. So we'll put that under the broad topic of legislation. Next up, emerging adults. So this would be youth 18 to 25. This has been sort of kicked around. More rehabilitative options for that age group of young people who are in the system, but maybe need more intensive services to get on a rehabilitative track as opposed to just being warehoused. This may be another item that the conversation would be, is now the time for this? Do we have enough appetite for this? Do we have the resources for another problem-solving court model? Because that's what this is. It's a problem-solving court. What do you think about this idea?
I like the idea of intensive services for that age range. They are still in need, even though they think they've grown. My question would be, a lot of the grants and things define youth up to age 24. And so would any of that change if we're saying it's an emerging adult now from 18 to 25 instead of youth from 24 to under?
Mm-hmm. So this is more like service provision in your mind? Mm-hmm. Okay. Other conversation regarding this one?
This is not really service provision in my mind. It's really, it's almost, shooting for the moon to see where we could get. Are we in Indiana ready to start thinking about having a youth justice system and a criminal justice system and an emerging adult system. 3 separate systems would be the moon. Does it mean we start with some kind of other model? But I don't know. So I would say if we're going to take this on, we should start thinking about shooting for the moon, because we will get back down from that. The other thing that the Multisystem Youth Task Force is not doing anything with the emerging adult population. They are working on young people transitioning out of systems, but this is really young people who are currently in the criminal justice system, that they are, does that system even make sense for them is the question, I think. But so just to clarify that task force isn't really working on anything related to the emerging adult world.
And I would just say, I see the idea as a slippery slope and maybe unequal justice, because what you're going to get then is, do I need a senior citizen court? Do we need a specialty? No, my brain's devolving now. So maybe I shouldn't have the full weight of the justice system. It just becomes really specialized if we want to talk about mental development or where we are in our life even. It becomes really fragmented and strange. And I think it could take you to some weird places. So I do see it more as a service delivery issue, I guess. Makes more sense for me in the sense that, sure, I do get that Kia sees young people, and I have a 27-year-old, so yeah, I get it. However, he's also an adult, and I have to treat him as such. So I think it's a service issue that should be looked at as maybe providing better help in the area where we have them, because this creating separate levels of justice systems, I think, is going to cause legal issues to some extent, because I'm not really sure how you get to fragment and say this person deserves this justice system that only does this, and this group of people in this age deserve this justice system. Like, I'm not really sure that it really calls for that. So I see it, I think service-wise, I can see why we would want those, but it's a big philosophical, another way of looking at things. So, I mean, I think we're talking, but I don't know.
Well, I think you could also look at this as a resource issue. So, for example, in the problem-solving court world, Marion County or Lake County may very well sustain an independent court, but when you're looking at Greene County or Ripley County, probably not, because Judge King doesn't have that many hours in his day to do separate courts for everyone. So in that way, I think we may be talking the same language. So instead of looking at putting this person in a separate system, you could infuse the principles for appropriate service delivery into the whole system. And in that way, emerging adults sort of fit with the WAVE direct file youth, looking at what are the appropriate services for this young person in this circumstance. So those two areas may go together. What do you think about that? For conversation.
Like services could be extremely varied.
Sure. Sure.
Juveniles,
15
years of age, for instance, like he is saying, they get waived. It's kind of like, well, each of one of those juveniles is so dynamic and complex, coming up with serving them with a program, if you will, I think is going to be a waste of time. I mean, and probably some resources. That's my perspective right now. Of course, this is probably something you all know a lot more about than I do, but that's kind of what I'm thinking. We're talking big items that deal with varied youth that have extremely difficult or varied problems. I would think, I expect the population of waived 15, 16, 17-year-olds, I think, this kid's nothing like this kid. That you can't come up with a program that these two kids are going to, I would think. So trying to come up with a program or even certain what services, what services you're looking for. I mean, there's probably some out there, but it would be a bunch of them, right? Be like, well, here's 10 of them right now. I can name right off the top of my head.
I mean, our main ones was mental health. I mean, it's a lot of 15-year-old to face 30, 40 years. Yes, he, was committed, or, found delinquent for this, but how do you prepare a 15-year-old to do 50 years in prison? And how do you keep him connected to a family source to survive something like that? And that's what we see. These kids, yes, they made this decision that is terrible and they deserve punishment, but there's a lot of healing that still needs to happen so that they are going to come out eventually. They might be 30, 40, 50 years old, but how are they coming back out? And how are we keeping them connected to the families, the work that we've been doing? Education is another one. Do they not get to finish high school? Do they not, you know what I mean? Because they've made these decisions. And so when we're in the Marion County Jail, there's nothing. They are literally waiting pre-trial for their sentencing, and then whatever happens in DOC happens in DOC. But sometimes those are years in between. And so there's a lot that can happen in there. We're not asking for them to be released or anything like that, but we can help them prepare for what's coming ahead.
Education stops.
Some, I mean, there's programs in the jail that, we have some GED kind of stuff that come in there, but it's very limited as to what services and what kind of programming they get while they're in that pretrial waiting stage.
All right. So I think I'm hearing that this may be a later conversation. Is that what I'm hearing? So this doesn't seem to be rising to priority number one for everyone. Okay. Okay. So I'm going to put that. Dream board is fine, Nancy. Yes. So I'm going to put that in the same list as the pre and post trial options for further discussion. All right, next up, fair and efficient processes. So looking at reviewing court processes to ensure for fairness, efficiency for youth and families, examining how hearings are structured, how timely decisions are made, and whether current practices align with best practices in procedural justice. Thoughts on this one?
I feel like that's something of, I guess, kind of a background, background philosophy for almost all of the work groups. Mm-hmm. So I don't know that it needs to be maybe siphoned off, but maybe that's just something that we can agree to do as one of our guiding principles.
Mm-hmm. Okay.
Yeah, I agree with that. And I also think if you're talking specifically about procedural practices, I think the Office of Court Services looks at those when they do have like timeline issues. Like, didn't they just go through that with Chins or some cases and decided, hey, this is taking way too long. We need to work on this segment. And so I think obviously if we find a problem somewhere or we hear of it, we could lift that up as something they would want to look at as their best practices to push, like, where is the holdup? What is the issue? Are we waiting for too long for bed space in juvenile court? Are we doing this or that? So I think it's something that we all need to be aware of, but I don't really know if it's a specific work issue for us right now.
Okay. I see a lot of nods.
It just seems like we're talking about how hearings are structured, that kind of stuff. There's judicial conference committees that focus on that, like the juvenile bench book committee, those kinds of things. So I think those are the folks that's their priority. I would hate for us to start trying to take over that priority as well.
Okay. Are we comfortable then treating this as a guiding principle for work of the other groups and not carving this out as another action item, separate action item? Okay. All right, community safety and public confidence. So some of these other initiatives may fall within that. So I'm hearing the higher felony crimes committed by youth probably fits within this. Gun violence may fall within this larger umbrella. But Mark had brought this up and others because this is a conversation. is a conversation probably every day. You pick up the newspaper, turn on the television. Youth violence is a big deal in conversation. So, what would you like to say about community safety and public confidence? Yes, Liz.
Just in the, to me, increasing public confidence means, well, we can tell you that when, you know, it sounds crazy when we do this, but the data shows that to us that it's actually helpful.
Chris, Dr. Alsma, what do you think?
I'm avoiding eye contact because I'm not sure it does. I was looking down. So I hear you on that end of kind of understanding perception. I'm not sure if it's a slam dunk in that area. We could do a lit review and send some information to you. But I'll defer to my friend Chris.
I was going to say yes, and it applies to the next one that's listed in the communications and public messaging. So
that's good.
Whether that, again, I'm going to question the appetite here of having another work group that is built around communications. And I oftentimes parallel this group with JRAC and State JRAC, and State JRAC has recently stood up a legislative work group to tackle first, and its first sort of initiative is competency development or competency restoration, excuse me. But also a communication work group that is looking at how we communicate, how we engage the various stakeholders of JRAC to ensure that when our counties are interested in the effects of Senate Enrolled Act 1, for instance, that the Association of Indiana Counties has a variety of resources, a lot of webinars that they've put out that we're pointing them in those directions to get the answers. So yeah, I think this community safety and public confidence is data, and then in addition to that, communication and public messaging.
Mm-hmm.
So does that link with the last engagement of local JRAC? So
sure does. I couldn't have queued you up better. I appreciate you.
So that does seem like, so I'm not sure if JRAC representation on work groups or elsewhere, but yeah, communication.
And Judge Dolahanty made the point that we do a lot of good things. There are a lot of really great initiatives regarding youth. And so we hear, like any other area of life, all the bad news on the news and none of the good news. And so how do we share the good stuff? So I think those two do fit well together: communications and public messaging, community safety and public confidence, engagement of local JRACs. Does that make sense, Nancy?
I think it makes sense, yes. I was gonna also add that I don't know how long, JRAC's been operating before the communications committee got developed, and this group is younger than that. So whether it's a priority today, or is it a priority after we have some data to share, not only youth justice system data, but also outcome performance measures from the grants. So like those are kinds of things that I think would be great to share, the good stuff, maybe the bad stuff too, but for a learning experience. But being able to say anything today, I don't know. Like, so is it something that we do as not a long-term, but more of a, let's get some data first kind of thing? I don't know. And I don't know, Chris, in terms of when that came into play with JRAC, needing some communications, was it as they matured?
As they matured. However, this is, and I didn't do this in my earlier presentation, this was something that was identified in the 2023 report. So sort of aligning YJOC with JRAC, but I think it envisioned the potential of sort of a local YJOC in the same way that there are local JRACs. So there's, we're still maturing. Yes, it was originally identified. However, it's also, we're moving. I think there's the JDI counties that have JDI are doing this. They're already engaging local stakeholders. Every county is supposed to be having a local JRAC. There's nothing that says you can't have a bullet point or a topic on the agenda to discuss your local justice or your local youth justice system. And I think that's probably, again, so that we're not trying to boil the ocean, that's the easy way to start, is to start talking about youth justice at your local JRAC. Everybody's time is valuable. Everybody struggles getting to these stakeholder meetings. So I suppose some of the messaging is around ensuring efficiency in the use of time.
I agree. The local JRAC and the community corrections, there's part of that statute that allows those two to be combined.
Yeah.
But when you get in the room with all the stakeholders, you'll find that everybody sometimes want to talk about the SMART program. They read about it or something like that. So then it's just became, okay, well, let's just put it on the agenda because everybody in the room wants to hear about it, to go to your point. So I add it, even though I was facetious saying, oh, go again. We're already doing it.
Yeah.
Frankly. It's already.
And I will say, like, I do the local JRAC annual survey, and every year it's the same thing is tell us what to talk about. Like, what are we supposed to be talking about? And if you ever see the local JRAC meetings, I talk about this. We are oftentimes in a position where, let's say Ripley County says, we don't want you to tell us what to do. We don't want to hear it from Indianapolis. However, please tell us what to do. And so we're never going to be this. Local JRAC, as Justice Goff has pointed out oftentimes, is really the local gear or the smaller gear driving the big gear. The small gear is Ripley County, and you're sending a message up and telling us what to do. So it's about reversing the normal chains or channels of communication from Ripley County up to the state level, rather than us telling you what you should be talking about.
Yeah, I agree that it could just be one. The other thing, the public safety, when you talk about that, I think that's an overarching principle, or at least it should be. That's why we're all in the room. We're in the room for the diversion. We're in the room for the alternatives, and we're in the room for the substance abuse. All three of those things trickle down to increase public safety. So I think that's why we're struggling with it. Like, well, no, that's probably a data issue. Yeah, you better have some data to back that up, at least eventually. Or somebody be like, well, no, it's actually not. Or I mean, if the inverse is true, that it's not facilitating public safety, then we have a systemic problem pretty fast. But I think it is. I mean, that's JDAI's principles, if I remember correctly. And then I think at some point we do, and maybe we're past that point, maybe we're not to that point, but people in our community are familiar with what we do because we put out information now and have a lot going on. Is it being disseminated in other spots? Is the transparency there? I'm a big fan of transparency. Is transparency there as far as what this board does and the results and the data that we're creating? I think it would probably be fleshed out, if you will, even more. But that's from maybe a higher level perspective. But I think it's incumbent upon those that receive the grants to also say, hey, here's public information that we're putting out about what we've been able to accomplish.
For the sake of time today, I'm going to suggest that the last 1, 2, 3, 4, 5, 6 items on the list. So fair and efficient processes, community safety and public confidence, communications and public messaging, engagement with other stakeholders, inclusion of youth and families in priority setting, and engagement of local JRACs on YJOC matters may very well be principles that are incorporated across the existing work groups. So think about that, how we can incorporate those. Is that adding questions on the month for the meeting reports so that that's an agenda item that's discussed in each meeting? Are there opportunities to share good news? Are there community communication issues that we need to address from our various vantage points? So I'm just going to throw that out there as an idea. And because we're short on time today, I'll just try to go through our action steps. So between now and the next meeting, I would ask that each of the work groups talk about their assigned points and bring back to this group their recommendations for next steps. We'll get with Judge Broadwell for additional information on her item. Judge King, I'll chat with you about legislative committee and what that might look like. I would ask everyone on this group to think about who the work group members should be on the legislative committee. So generally the work group members are not people at this table. You're certainly welcome and we would love to have you, but we're looking at people with certain expertise. So if there are people who should be on that particular work group, think about that and who we should issue invitations to serve. What have I missed, Chris?
You have missed nothing. Very thorough. Just the right answer.
All right. Any other business for the good of the group today? All right. A lot of great work today. So thank you, everyone. Have an awesome rest of the week.
Meeting. That's awesome. Do more. I met with our friend Lauren.